finally got moved in and can start settling down, getting things unpacked. Thank goodness. Did everyone enjoy the International Day? Was it fun? You guys like it? I'm sorry it wasn't in person. I mean, obviously, ideally in person would have been so much better, but I hope you guys enjoyed it. It was definitely a lot of fun. Me and Mr. JT had a lot of fun presenting it. We always like to do fun stuff like that. You'll see in research as well. We do cool stuff in research like that. And we've actually joked that we need to start our own like Harris Health podcast or something. So maybe we'll do that eventually. Because we do have a lot of fun doing that stuff. But glad you guys enjoyed it. It was a lot of fun. Professor Drip, yes. Professor Drip. Thank Jeevan for that nickname. Left me hungry as well. What was I going to say? Yeah, and congratulate the seniors that won. If you see them, guys, it's hard work winning those awards. It's a very steep competition, and they really set the bar high on these research topics, these papers, and these speeches. So when I say they set the bar high, you guys got a high bar to hit. You guys definitely got a high bar to hit. With that being said, I actually really look forward to seeing what kind of stuff you guys come up with, because one of my favorite classes is research, because it's just, I love writing, I love research, and I love seeing what you guys come up with, because my favorite part of research is the fact that most of you will probably hear say, well, I can't write a paper. There's no way. I can't do APA format. That's just too much. I cannot write to save my life. But I have a lot of fun proving you guys wrong on that, because everyone ends up doing it and doing it very well. You're going to do awesome. So if you haven't started thinking already, I know it's a little early, start thinking about those topics. Start brainstorming, because I want some interesting topics next summer. I want you guys to really wow me. It's a ton of fun. So I'm really looking forward to that.
What can we write about? Like, just any research or?
Well, basically, it has to be related to medical imaging, but it also has to involve a pathology. So, for example, just a quick example, let's say you want your pathology to be tuberculosis. You'd find a new imaging technology that's used to image tuberculosis, for example. Like a couple of our winners, like Jackie, she did hers on space flights, but they have ultrasound machines and X-ray machines that they actually have on the International Space Station, that they can do X-rays on the astronauts' eyes to make sure their eyes don't have retinal tears, for example. So the pathology would be the retinal disease, like detached retinas. The technology would be the International Space Station X-ray equipment, so on and so forth. So there's all kinds of routes you can go. It just has to be a pathology and medical imaging related. Well, to answer your question, Jessley, that was my real vocals, but I was lip syncing on the music video. If you know how they make music videos, you record the vocals first and then you lip sync to the video. So that's how I did that. It was a little off. I could have edited it a little tighter, but it turned out okay, I think. That was fun. Actually, I have not done that in years. I used to sing a lot more when I was younger. I haven't done that in years. But I was having a real downer week. You know, anybody that's in music, if you're having a real downer week, sometimes you get more creative. You just write stuff down. So I started writing stuff down and singing the lyrics and decided to go with it and make something for you guys. So glad y'all enjoyed it. I was hiding in the corner, though. I didn't want to watch it. When it was playing, I was hiding in the corner. I ran away. I hate seeing myself on camera. I can't stand it. All right, let's see, guys. So we do have a test on Wednesday. So we're going to do our usual quiz is review. I've got about 20 questions queued up for you guys. So let me get this pulled up, and we're going to get rocking along here. Get you guys prepared for that test on Wednesday. And then my final practicum people, you'll be meeting on Tuesday tomorrow. Those of you that are scheduled for practicum, don't forget that. Just a small number of you guys left, and be looking to Praxis School, because once I do that last group tomorrow, I'm going to upload the grades for those. And basically, you get through it, you're getting 100 on the practicum. So those of you that have already made it through the practicums, you're going to have hundreds on those. So that'll give you all a little score boost. So be looking for that. All right, let me get this pulled up here. All right, guys, you know the drill. There is the code at the top. Go ahead and log in, and let's see what kind of crazy names you guys come up with today. I know it's Monday, but let's see that creativity. Let's see what you got. And the first one I get is just an S. I wouldn't call that the most creative name I've ever seen. If my connection's a little wobbly, guys, I got a Wi-Fi booster coming as well, because my Wi-Fi is downstairs, unfortunately, and I need to get a booster for it to reach up here. Cutie form of the left footy, Mr. Koenigsegg. I don't know what that means. Little corn cob. Okay. Okay, we're getting a little better with the names. A little bit better. Oh, come on, Daniel, no puns today? I expect more from you by now. Come on. It's just too much of a Monday, right? I get it. I get it. All right, guys, I think that is everybody. Let's move along here. Here we go. All right, any chemical substance producing a biologic response in a non-living system is a drug. Is that true or false? That is false. That is false. Did I get any of you? Let's see. Oh, okay. Who can tell me why that's false? Did you read it carefully?
Non-living system.
Non-living. Correct. So what should that say?
Living.
Should say living system. Living system. One little word change. Not trying to be tricky, but making sure you read those questions carefully. Read them very carefully. The science concerned with the origin, nature, effects, and uses of drugs is called and that, of course, is going to be pharmacology. Pharmacology.
Topology.
A blank is a classified system of names. That's going to be a nomenclature. Nomenclature. All right, which of the following are a part of the drug profile? That's going to be absorption characteristics. The other three were made up. That slide, guys, about the drug profile. There's a lot of parts of the drug profile. Make sure you know those. You're going to see some questions on that from me and the registry. Which of the following are patient rights in regards to drugs? That's going to be all of the above. There's actually 5, even though 4 were listed there. All the above. Another important slide to make sure you look over, guys, on that one for me and registry. Know all of those patient rights and make sure you know what they mean as well, how they're actually defined. If a patient's name does not match the armband, it is appropriate to continue the procedure as long as you have them verbally confirm who they are. And I hope everyone put false on that. That is definitely false. We always get that armband fixed before we continue the procedure. Even if we see other techs doing that, the radiologic technologist determines the time of drug administration. True or false?
That's true.
And that's going to be false. Who can tell me who determines that? Who determines the time?
Radiologist.
The radiologist or one of the physicians. That's correct. That's correct. Even though we administer it, the actual time is determined by one of the physicians. We never actually come up with the time for that. The physician determines the route the drug is to be administered. True or false? And that one's going to be true. So same as with the time, the actual physician will determine what, especially with contrast administration. Good. Which of the following must be documented when administering drugs? And that's, of course, going to be all the above. Once again, all those being extremely important to make sure we document them very specifically. Very important point to remember. We're going to document all those main points. Good. Drug administration errors are the most common medical errors associated with rad techs. True or false? And that is true, and that's because we administer so many different contrast mediums. They'll choose the wrong type of contrast, they don't communicate, they use the wrong route, they don't check allergies, etc., etc. That would be true. Which of the following is considered an enteral route? Enteral route. It's going to be buccal or buccal. Buccal or buccal will be considered an enteral route. The opposite of that would, of course, be parenteral. Parenteral would be an actual IV injection, needle injection. Administering a drug on the surface of the hand is an example of which of the following? And that's going to be a topical administration. Topical or also transdermal would also fall into that same category. Topical or transdermal. Be careful, intradermal, even though it has the word dermis or dermal, dermal referring to skin, intradermal refers to inside the skin. So via needle injection going underneath the skin. Same with intramuscular, that's actually injecting directly into the muscle that would not be on the surface of the hand. An intravenous injection must be inserted with what angulation? Out of those following choices? That's going to be a 25-degree angulation. There can be a bit of a spread there, 15 to 25, but the most common would be 25. That's what you should do at first when you do your first venipuncture injection. Make sure you slide, by the way, make sure you know all those different angulations and what they refer to, such as 90 degrees would refer to intramuscular, 25 intravenous, 10 would be the intradermal, the different types of injections depending on what we're trying to do. Make sure you know those different angulations. Generally, the blank is considered the safest type of venipuncture device. And that's going to be the angiocath. The angiocath. Even though the butterflies are very convenient, I like butterflies myself. As far as safety is concerned, it's considered the most safe. And part of that reasoning is because it has a little catheter on the outside of the needle. We can insert the needle, retract the needle, leave the catheter in, do our contrast administration, and it's considered a very safe method of administering whatever drug we're using or whatever exam we're doing. Which of the following is the largest gauge needle size? That's going to be 6. If you do remember, the smaller the number on needle gauge, the larger the diameter of that needle. 6 being the largest out of those choices. So be careful on that, guys. The smaller the number on needle gauge, the larger the diameter, the larger the size. And remember that, guys, I can guarantee you'll be asked that on your registry exam. They're going to ask you about that needle gauge size. It's a very important point to remember. I see what I did there? Important point to remember. Oh, yeah. Great pun. Yes. Okay, I got a couple smiles there. Couple smiles. I got a cringe smile there from a couple of you, too. You gotta get used to my bad jokes, guys. I know it's only the second semester with y'all, but I got lots of great, terrible jokes coming your way. I guarantee you. You ain't seen nothing yet. A device used to prevent multiple needle sticks is called a what? That's going to be a hep lock. Hep lock. That's inserted over the point where we have a needle inserted. It's kept there when multiple medications are being used on a patient. That way you don't have to keep sticking them over. Just administer the drug directly into the hep lock, push the drug in. We don't have to keep sticking the patients. When the vein is missed and contrast begins to flow into the area surrounding the vein, causing pain and discomfort, this condition is called what? That's going to be extravasation. Extravasation, also known as infiltration. Remember both terminologies, both words, extravasation or infiltration. Extravasation or infiltration. Intravasation does not exist. Inflammation is a different condition, and compromised vein is also made up. So remember that word, extravasation or infiltration. If an IV pump is beeping, the technologist should walk away because touching the arm could cause major safety issues. And of course, that's false. You would always investigate why it's beeping. Make sure you silence it appropriately, and of course, let the appropriate staff, such as nursing physicians, know that you stop that it is beeping and communicate that appropriately. A technologist should always blank everything that occurs during any procedure. And of course, we know the answer, guys. I mean, if you're like me, you're going to angrily curse everything out. You angrily curse what's going on. That's the definite method of choice. That is document everything. I'm sure you guys have already gotten sick of me saying that, but of course, a very important point to always remember to document everything we do, especially in this day and age that we live in now. All right, our final question. Let's see how well you listened on International Day. This is an International Day program-related question. What did Dr. Black say during his interview that he would do to an elephant he could not get rid of? And that was eat it. So you never know what's going to come up on the test. You always got to listen even to our fun programs. You never know question on the test. The elephant. All right, let's see how we did. All right, in third place, we have Little Sleepy. Second place, S. In first place, Jonathan Negri. So who is Little Sleepy? Who's Little Sleepy? That was Naomi. Who is S? Wait, what?
Me.
Oh, you're okay. Good job, Sharon. Good job. Good job, guys. So that is an example of the type of questions you can, of course, expect on your test on Wednesday. I don't know the exact number yet because I have not made the test, but probably 30 to 40 multiple choice questions is what I'm thinking. That's what I have in mind. So any questions on the tests for Wednesday? Any other general questions? Anything you guys need to know? Anything you need to have clarified, confirmed? Anything at all? Anything I can answer for you? Going once. That's going to do it for patient care this morning. We're not going to go to the next chapter, of course, because we have a test coming up. So you guys can enjoy a little bit of extended break before your next class. Go get that next cup of coffee, like me. I don't know if I'm going to go for number 4 today, but it's very tempting. We'll see what happens. Go enjoy your extended break, guys. Get some breakfast, get some coffee. I will see you guys at 1 o'clock, and we're going to start the wonderful world of the pelvic girdle and the femur. Lots of anatomy to go over today, so get geared up. We'll start getting through it today. See you guys in a little bit. See you at 1. Bye.